Hello, thank you for joining us in our Health Talk series, and today we are going to be looking at ectopic pregnancy. What is ectopic pregnancy? From the word ectopic, which means abnormally sighted, ectopic pregnancy means a pregnancy that is abnormally sighted. So it is a pregnancy that is not sighted within the womb. It can be sighted along the fallopian tube, which is the tube of the womb, or even outside of the womb. What happens is that a fertilized egg by the sperm travels, instead of down to the womb, travels retrogressively backwards and sometimes implants there, or falls out to implant in the abdominal cavity. So what causes this problem? The commonest cause of this problem is an infection in the womb, what we call pelvic inflammatory disease, pelvic inflammatory disease, PID. And PIDs are usually caused by STIs. The second most important cause is scarring of the womb. The womb can be scarred from D&C, or dilatation and curettage, that happens after a miscarriage. That's vacuum aspiration that they do for women after miscarriage. So these are the commonest causes. So what are the symptoms? If a woman is expecting pregnancy, as in 2-3 months pregnant, she has symptoms of pregnancy. Suddenly she starts feeling severe abdominal pain or tummy ache, which is very, very painful. And then suddenly, after the pain, bleeding comes. The bleeding is usually heavy. So any woman that thinks she is pregnant and presents with lower tummy ache and bleeding must be rushed to hospital, because it is going to be an emergency. So what are the treatment modalities for this problem? The first thing they do in the hospital, she's likely going to be admitted in the gynae emergency unit, and she will be given drips because she has lost blood, and investigations will be taken. A blood sample, will be taken, which they will use to take for a cross-matching for possible transfusion. So as part of that treatment plan, they will also scan the abdomen to see what the problem is. Sometimes they see the pregnancy as ectopic, abnormally sighted, and sometimes they see other problems that are related, like a miscarriage. So as the condition is diagnosed by an ultrasound scan, when it is ectopic, the doctors have no choice but to enter into the theater for an emergency surgery, and that is how it's going to be evacuated. So how will you prevent yourself from having an ectopic pregnancy? A woman that has protected herself from sexually transmitted infections and getting pelvic inflammatory diseases will most likely prevent herself from ectopic pregnancy. Thank you for listening, and see you next time.